Now, Paula, how is dementia being dealt with in countries across Asia?
Well, very differently, that is the answer. So certain countries are way more advanced than others. And I would put it in two different ways. There is an issue about acknowledging that you have a problem, and some countries are still in denial about having a problem. So around the world, not all countries have even acknowledged the existence of dementia as an issue in their country.
Okay.
And some other countries are really leading the way and telling us they have definitely acknowledged they have a big problem. And I would say in Asia, Japan and Korea are definitely doing the most. Japan has been a groundbreaking country where we are having this interview now, and we'll talk about it later. It's an example of some Japanese innovation being brought around the world. They have been great. Korea now are investing a huge amount of resources into getting the entirety of the population on risk reduction and prevention measures, on dealing with the care issue, on informing their population on a state, on a government scale. Some other countries, I'm afraid, are lagging behind. For example, we know that in Nepal it's been very, very difficult to make any progress. But some others are doing what they can within the means that are available to them. I think what you're doing now, raising awareness and informing your population about this, is one of the most important things we can do. Because actually, how can the population demand action if they don't even know that this is a disease? So we need to tell people, look, this is not old age. Your grandparents, in many cases, dementia is going to be dementia. It's not going to be them just growing older, and we have to do something about it.
All right, Paula, this is, I'm going to put you on the spot here. I have to ask you this question now. What is your opinion on the whole global initiative to say, let's do something about dementia? Why did it actually take so long?
Well, I think that in part is because the dementia movement as such didn't get it organized, it didn't organize itself soon enough. So if you look at cancer, their international body was set in the 30s, the dementia body was set in the 80s, so we missed pretty much 50 years in raising awareness. We are now looking at the examples of other healthcare movements like cancer, like AIDS, that have managed to attack our biggest enemy, and our biggest enemy is the stigma at the moment, as well as the disease itself. Because unfortunately, and all of your viewers will remember, 30 years ago, you know, if people thought they had cancer, they wouldn't want to get themselves diagnosed. Would you do that now? No, that would be a super stupid thing to do. You would want to go to your doctor straight away and ask for a diagnosis. So we need to get there with dementia. We need to get people demanding to know what they have and understanding. And sometimes people tell me, well, if there is no cure, then why would you want a diagnosis? Well, they're saying for cancer, not all cancer there is a cure, but you still would want to know what you have, because you can do a number of things, as in with dementia, to make your life much easier and your family life much easier as well. We advocate for research in dementia, and we've been talking about the pharmaceutical element, but actually there's a whole field of dementia research that looks into care. So you can make the environment of people with dementia much easier. You can look after the health of family members of people who have dementia, and that's very important. There's a huge amount of things you can do, for example, with rehabilitation. If people knew how much can be done, and in this center here where we're talking from, they do all kinds of sessions to help people with dementia acquire a number of mobility skills that will help them and will slow down their cognitive deterioration. So there's a lot that you can do. But yes, the Alzheimer movement got organized much later. And I think now there is more awareness, I think, globally, and people, though, are still fearing the disease rather than trying to find answer of what can they do about it. And that is true in higher income country and low income country alike. The ADI movement has always been global, so for us it's always been about getting in this together, learning from each other together, and in a lot of the country I go, that people wouldn't necessarily think are, you know, very rich. I went to Costa Rica, for example, last year, and I saw one of their hospital program is the best I have ever seen, about training doctors and nurses in dementia and how to deal with environmental and personal issues in a sensitive manner, in a way that I haven't seen elsewhere. Today in Malaysia I saw a fabulous rehabilitation room, for example, and that was really nice to see. So each country really can contribute something to the debate. It's just about us putting everybody together to talk about it.
Now we have to talk about 2017. WHO actually made a global action plan for dementia across all countries. Now Paula, can we discuss the 7 cross-cutting principles of that plan?
So the first thing about the Global Action Plan is that we at ADI have been waiting for years for this to happen and contributed very strongly for it to happen. So we are totally delighted with the 7 areas. So the first point of the action plan is the government must acknowledge they have a problem by raising policy issues within the government about how we're going to deal with a dementia epidemic. So being cognizant of the numbers, being cognizant of the care facilities that are offered in each country. Then awareness raising is the second point. So we were talking about before stigma awareness raising. It's very important that each country, according to the plan, take responsibility for public health. So essentially that is the main point. We can do so much. We organize World Alzheimer's Month, World Alzheimer's Day, we organize themes, but each country really needs to bring those themes more broadly into their entire population, because otherwise how can we know that we succeeded? And that is not just in the wider population, but also primary care doctors and nurses. So the first professionals that the person that thinks they may have dementia see. So not just the specialists. So everybody should know more about it. The third point is around the creation of a dementia-friendly world, if you want, a dementia-friendly society. So how can we make the environment more aware that dementia is something that exists, and instead of suggesting that people with dementia don't socialize, knowing full well that socialization is one of the elements that helps them keep happier for longer and live longer.
Accept them.
We may need to make everybody accept them, and this is what they're trying to do here in the Atrium Hall, and that's a wonderful thing to see. The fourth principle is around risk reduction. So a lot more has to be done about telling people what we were discussing before. You've got to exercise, you've got to eat healthily, because this is really going to develop more protection. And the good thing about it is also that many other non-communicable diseases have the same factors. So, you know, you get 2 pigeons with 1 stone, as we say in England. So it is a good thing to do. And then, of course, there is care. So care is what a lot of people are worried about with dementia, because care is what is so difficult to get right, and it can last for so many years with dementia. At the same time, as we said, the acute phase of dementia is often the last phase, but you can have many happy years in an environment that is caring and supportive for you, and that understand what it is that is good for you as a person. We are a very great advocate of person-centered care, so every person is different.
Right, this is Health Matters with me, Dishen Kumar. Very interesting conversation we have on dementia. We have to go for a short break. We'll be back right after this.